Bismillah ar-Rahman ar-Rahim. We are now going to discuss ethical issues that arise in research. The ethical issues in research can be considered using maqasid al-sharia and qawa'id al-fiqh. Research is needed in order to discover new ways of treating disease, and in that perspective it fulfills maqasid al-sharia. The second purpose of the sharia is hifdh al-nafs. So research to discover better ways of treating disease contributes to hifdh al-nafs, protection of life and health. But as we undertake research, we need to follow certain principles. The first principle of fiqh that relates to research is the principle of intention, qa'dat al-qasd. What is the intention behind the research? Is it for benefit of the public, or is it for the benefit of an individual? So it's very important to make sure we have clean intentions from the beginning. We also need to follow the principle of certainty, qa'dat al-yaqeen, that as we undertake research, we must use evidence-based approaches to make sure that we do not deviate from certainty. There is qa'dat al-darar. There is the principle of injury, qa'dat al-darar. We need to weigh the benefits and harms of the research that is being taken. Research should never be undertaken without informed consent of the person on whom the research is being carried out. Informed consent means that you explain what you are going to do, why you are going to do it, what are the advantages, what are the disadvantages, to make sure that the research subject understands all of these aspects very well. Then they can consent to be in the research or not to be in the research. And we make sure that they understand that they are free to decide to be in or not to be in the research. Research publications also raise some ethical issues that we can discuss later, because some people may not follow ethical rules in publishing the results of their research. Animals can be used in research, but we need to respect also their rights, to be kind to them and never cause them undue suffering. Research is an ethical obligation. In fact, I would like to call research a form of ijtihad. We need to do research to improve our medical care. But as we look for new treatments through research, we need to consider that the research process is a risk to the research subject, but there are benefits from the research. The benefits must outweigh the risks in order for us to go ahead. If the risks are much more than the benefits, then we do not undertake the research. As explained before, research cannot be undertaken without informed consent of the research subjects, and we must give full information about the research for that consent to be considered informed consent. We sometimes, in testing a new drug, divide the patients into two groups. We give the new drug to one group and give the old drug to the other group in order to test whether the new drug is better than the old one. This is a process of randomization. It has got an ethical issue in that the patients getting the new drug are being exposed to something new, and the patients getting the old drug are not getting the benefit of a new drug that may be beneficial. Patients under the stress of disease may not actually give free consent because they may not be in a mental condition to digest and understand the information that we are giving them. So we have to be very careful to make sure that we seek consent for research when patients are not under stress and they are able to understand and follow what we are discussing. Now let us look at some case scenarios to apply the principles that we discussed. The commander of an army brigade asked the physician of the brigade to do research to find out why many soldiers are asking for sick leave. So the doctor took blood from the soldiers to look at their immune profiles. But some soldiers protested. They said, look, we are not asked for consent. He told them he was following military orders. So what do you think of this research without consent? Would you go ahead to do it or not? What are the ethical issues involved here? The second case scenario is about a physician who was recruiting patients for a large multi-center study of myocardial infarction. The informed consent sheet that gave information about the study was very long, 10 pages, because there were many details to disclose to the research subjects. So the research subjects, the patients, were bored reading through or listening to all these details. And they told the doctor, look, doctor, we trust you. Let us just sign without understanding all the details. What do you think of this? Is this ethical? Is it acceptable? Would you let them sign without fully understanding what they are signing? Case scenario 3 is about a new drug that had proved its efficacy against leukemia in laboratory and animal studies and preliminary studies in humans. But the drug was not well understood in terms of its risk to humans. The decision was made to test the drug against a placebo. A placebo means a drug that's not actually a drug, something empty. But when you divide the patients into two groups, one group you give them the drug, and the other group you give them the placebo, which is actually not effective. In this case, there was no known effective treatment for the disease. What do you think of this placebo trial? Is it fair to carry out a placebo trial? What are the ethical issues involved? What's your opinion? And what's your moral reasoning? Case scenario 4 is about a research on a drug carried out in several hospitals. The last hospital to join the study, which had been going on for 5 years, were told to stop the study halfway. Why? Because results from other hospitals that were in the study, in the trial before, showed that the new drug was superior and there was no need to continue the experiment. So the decision was made by the sponsor of the study to terminate the study and cut off the supply of the drug to the patients. Do you think this is ethical? Is this correct? What's your moral reasoning? Let us now discuss issues of ethics in public health research. Until now, we were discussing clinical research that goes on in the hospital. Public health research goes on outside in the community. Like clinical research, it requires ethical approval by a competent body that approves research. It's different from clinical research in that we are dealing with community rights vis-a-vis individual rights. In a clinical trial, we are dealing with one person at a time whom we ask for permission to be part of the study. In a community research, we cannot get informed consent from each individual in the community. So this is an ethical issue that arises. We also need to consider benefits and risks, and we need to consider the issue of informed consent for the general public. But whatever information we get must be kept private and confidential, and we have to avoid conflicts of interest. Now, in interpreting results of public health research, we have got to be very careful, because controversial findings that scientists discuss among themselves, if this discussion is made in front of the general public, it would cause confusion. So we need to be careful about how we interpret the findings of the study and how we communicate these findings to the general public. Let us look at case scenarios to illustrate the principles that we discussed. Case scenario 1. This was a community randomized study to find out whether adding multivitamin tablets to food served in public restaurants would reduce cardiovascular risk. Permission was obtained from the mayor of the city, since it was not possible to get consent from each individual participant. Do you think that this is informed consent? Is this valid consent? Can we go ahead to do this research? Please give your moral reasoning. The next case scenario is about a new vaccine against flu. It was found effective overseas. So the Ministry of Health wants to test this locally, because it doesn't want to bring a vaccine from outside and just use it locally. The local people may be different from the people overseas. However, there was a big negative media campaign and nobody volunteered for the study. So the ministry, because they wanted to solve the problem, to know whether this vaccine is useful or not, they decided to force all health hospital employees above 50 years of age to enter the study. Do you think this is ethical to force them? What are the advantages, disadvantages? What's your moral reasoning? What are the alternatives that could be pursued to resolve this issue? Now let us discuss ethical legal issues in writing grants and publication. There are many issues in publications, and there is research malpractice, which is prevalent. The attitudes vary. In some places, people are very strict. In some places, there is a laissez-faire attitude. Research malpractices arise because professionals want to go ahead in their profession. They want to be promoted. And promotion depends on how much you publish. So the pressure to publish sometimes pushes people into research malpractices. These malpractices could arise in terms of authorship and investigators. Some people could be put on the research report as authors and investigators when actually they are not. They made very little contribution. Other people who did make a contribution could be dropped, and these issues do happen from time to time. There's the issue of originality, that when you publish, are the ideas there your ideas, or the ideas you got from other people? Plagiarism is defined as taking somebody else's ideas and presenting them as your own ideas. We need to detect plagiarism and to avoid it, because it is considered a form of cheating to claim to have ideas that don't belong to you. Now, what about protecting your ideas from potential plagiarists? Normally, in a hospital situation, you want to discuss your research ideas with your friends, but you are not sure. When you discuss with them, one of them may pick up your idea and go ahead and do research. And you get surprised when you see your idea being published. So, should we discuss our ideas with our friends, or should we keep our research secret? The issues of confidentiality and privacy. When we do research on human beings, we must respect their privacy and keep all their information confidential and never disclose it. We need to get informed consent from the people doing research, we do research on. We need to disclose what we are going to do to them, and we need to have financial integrity and avoid conflicts of interest in our research. We should not allow sponsors of research to give us money and gifts that can affect our decisions or our interpretations of our data. And of course, we need to follow the regulations about research that are existing. Now, let us look at case scenarios to illustrate the issues that we have presented above. A professor of cardiology carried out a well-designed study on a drug that had been marketed for 10 years before. Now, the results he found were against what many other researchers had published, and they looked illogical to him. So he told his team of researchers, please keep this information secret, because he was worried. Towards the end of the study, he again analyzed his data, and he confirmed the preliminary analysis. So he said, no, I will not submit these results for publication because my reputation may be affected, and it also may disturb other cardiologists. So this is a researcher who found something, but because it did not agree with what the majority of other researchers found or talked about before, he's hiding this information. Is this ethical? Do you agree with this? What's your ethical reason? In order to avoid ethical violations in research, institutional review boards, so IRBs, were set up. These are bodies that review and approve research. So their role is to make sure that the research is carried out accurately and that the patients are protected from risky research. Members of the IRB usually are professionals from various disciplines, including a community representative who shouldn't have any medical background. We want to make sure that the opinion of the average citizen is represented in the meetings of the IRB. Now, there are many details about the IRB, many documents that are submitted. There are criteria for reviewing the protocols. There are criteria for reviewing the qualifications of the investigator, because if the investigator is not qualified, we shouldn't allow him to do the research. And after that, after approving the research, there is auditing to check how it is going on, to monitor, to inspect, to make sure that the research is being carried out according to the standards and procedures that are expected. Let us now look at some case scenarios. Case scenario number one. This is a very experienced professor of surgery. He wanted to do research, and he knew all the rules, the ethical rules about doing research correctly. He knew all the regulations, and he was sure he fulfilled all the regulations necessary for research. And he saw no reason to go to the IRB for permission to do his research. And anyway, he said the members of the IRB are very inexperienced members, and many of them were his students. What do you think about this? Is it right to do research without getting permission from the authorized body? What's your ethical reasoning? Case scenario number two is about a physician in a hospital who was given a big grant to do research, and the consent form, the information in the consent form that he had to be given to the patients was very long, and the subjects also could not follow the dates of visiting in the protocol. So he made changes in the protocol that he thought were very simple, and he saw no reason to inform the authorities. What do you think about this action? Is it ethical? Is it right? What's your moral reasoning? Case scenario number 3 is a physician in a local hospital who agreed to be an investigator in an international study sponsored by a big company. The study is carried out in several other countries. He regularly sent the data to the sponsor overseas. But on one occasion, the sponsor questioned the data submitted. He said, I don't think this is correct. And he said that the original patient's chart should be shipped overseas for inspection and verification. What do you think about this? Is this right? Is it ethical? Does this follow the guidelines? What's your ethical reasoning? Now let us talk about the major issue of conflict in research. Conflict in research means that you have got a conflict of interest. It may be financial or non-financial. Now, a conflict of interest is a situation in which your judgment about your research is affected by a personal benefit that you can get. It could be that a member of the IRB which approves research has got a conflict of interest because one of the people submitting research for approval is related to him or her. So we need to make sure that the members of IRB are aware of this conflict of interest. We need to make sure that investigators are aware of their conflict of interest, because an investigator may have a personal benefit in doing and reporting research in a certain way. That's a conflict of interest that's not admitted, that's permitted. Let us look at some case scenarios of conflicts of interest. This is an IRB, a body that approves research, and a research project was presented. Members of the committee, each one of them had a conflict of interest, either because of having a relative, having financial relations with the company that was presenting the research. So only one member was free of conflicts. Now they said, well, we can go ahead to discuss this project and make a decision because now we know everybody's conflicts of interest. Do you think this is right? Can they go ahead and discuss this proposal despite being all tainted with some conflict of interest? The second scenario is a hospital that received a big grant from a company to do a study on a drug. But they noticed that doctors in the hospital were not prescribing the drug, so the research was not proceeding quickly enough. So the principal investigator called a meeting of all physicians and asked them to prescribe the drug so the hospital shouldn't lose the research grant that was given. He told them that this drug is already effective and was safe. Please prescribe it. Do you think this is an ethical action? Do you agree with him? What's your reasoning? Thank you very much for listening.